Good morning, friends. Mm, a few months back, precisely in December 2018, I attended a CME in Dental Association, where I was invited to deliver a talk on BCLS. But there was another talk. It was about how to establish your dentistry practice and how to become successful in that practice. That made me think about preparing this presentation, that how to become a successful freelance anesthetist. Usually, when a newcomer in anesthesia start practice, he or she doesn't know how to start the practice, how to build the practice. Everybody don't get jobs in government hospitals or corporate hospitals. So obviously, most of them start freelance practice without any teaching how to establish himself or herself as a freelance anesthetist. So I thought of preparing this presentation, and this is all about how to become a successful freelance anesthetist. I posted this on the group The Anaesthetist also, which is a very huge group of 20,000 anesthetists, to know the thinking of other colleagues also, that how to become a freelance anesthetist. And there were roughly 300 plus comments, and by that I can gather some information, and I can prepare this presentation. I started my practice in a trust hospital for just for few months, and then I did freelance practice for almost 9 years. And for last 9 years, I am working as a head of the department in a corporate hospital. But I did freelance practice for 9 years, so that I know how is the freelance practice and what are the advantage, disadvantage, and how to establish as a freelance anesthetist. So first question come to our mind is, what is success, and who according to you is a successful anesthetist? Is it all about money? No, isn't. Earning money is a different thing, and being a successful anesthetist is a different thing. Even if you are not good at your skills, and if you are lucky enough, you earn lots of money, but you are not successful. uh, but for being successful, you must earn some good money, you earn some good respect from your surgeons, you should earn respect from your patient, you must be involved in some academics, you must learn something through academics, you must teach something to your colleagues, your juniors. This is what I mean success is. So when I search on Google, I found this is the exact definition of success in my mind. Success is liking yourselves, you like yourself, liking what you do. This is very important. You should like what you do. As a freelancer, you should not regret doing something like going to a surgeon where there is not adequate facility and you are doing practice. That is not success. And liking how you do it, you should follow the principle of a safe anesthesia, which ensures safe surgery and safe patients. So success is like that. It is liking yourself, liking what you do, and liking how you do it. That is what success is in my mind. And success is a journey, not a destination. It is a continuous process. If you want to become a successful person or a successful anesthetist, you should keep doing something to remain at that place, or to go ahead, rather than you just become successful and stay there only. You must progress. So success is a journey, not destination. So moving to how to become a successful anesthetist, this is really very important, and the answer is varies from person to person. In your mind, what is success is different from what it is in my mind, but I will try to show what I believe. So when you start your practice, you don't know from where to start, whom to meet. As a freelancer, you don't know, you don't get trained about these things during your residency, from where to start, from to whom to meet. You start roaming around and you get some course from XYZ surgeon and you start practice. You don't know anything about practice, freelance practicing. You don't know about how good is the surgeon, how will be the setup, monitoring standards are followed or not. You compromise on lots of things, and sometimes you get trapped in some complication, and you start regretting about your freelance practice. So you should know how to start it. So practice management is about four aspects. First is surgeon management. We are dealing with surgeons, so we should know how to deal with surgeon and with which surgeon you should work. Patient management, that is very important. If you don't manage the patient properly, obviously you will be a failure. Financial management, it is a truth beyond that. We work to earn. It is always true. We require some money for our living. We require money for our kids' education. We require money for our vacation and everything. That's why financial management is very important. And practice enhancement and development, which is often forgotten by freelance anesthetists especially. So first part is surgeon management. How will you manage the surgeon? There are three type of surgeons. This was discussed in the group, and I think Raghavendra sir told about it. There are three types of surgeons. They might be good, bad, or ugly. So how is the good surgeon? There is good surgeon respect to their anesthesia colleagues. This is very important, and your anesthetist colleague is equivalent to you. He has done MBBS, he has done post graduation for 3 years, so he is equivalent to surgeon. So surgeon must respect to anesthesia colleague. Never interfere with their preoperative assessment and advice. Anesthesia is subject of anesthetist, so surgeon must not interfere in this preoperative assessment and advice, and good surgeon never do it. Never challenge the anesthesia technique chosen. Sometimes we like to give regional anesthesia to certain patient and general anesthesia to certain patient. Surgeon can obviously discuss with the plan, but he or she should not interfere with the technique. Do not treat them as subordinates. This is a common problem everywhere, but things are changing slowly. uh, I've seen that a number of good surgeons are increasing in freelancing practice as compared to what I see saw 20 years back. Accept whatever responsibility for surgical and anesthesia related problems. Surgeon is the main person who is connected directly with the patient, so he should accept both surgical and anesthesia related problems. He should take responsibility for both. Show polite behavior. This is very important. Some support them whenever needed. We need surgical help when we are in when there is some complication or some emergency situation. In such situation, especially in freelance practice, you don't have any second assistance. At this time, if surgeon is good, he will help you to come out of that situation. Bad surgeon, people who know the worth and value of their anesthesia colleagues. They know the value of anesthesia colleague but would not admit that. And they are very cunning people. This type of surgeon especially. All surgeons are not like that, and I will say only 20% of the surgeons are like this. And they will not admit that also. Exploit their anesthetists as far as remuneration is concerned. This is commonly happening for years. Many surgeons exploit their anesthetists, would not hesitate to change their anesthetist for no particular reason, and most of the time reason is increase anesthesia fees or charges to the patient. They change their anesthetist for saving some bucks. Consider them as dependent and subordinates and interfere with decision taken about choice of anesthesia. This is a common habit of bad surgeon. Take full credit for all successful outcome. Even if he is doing appendectomy as a 3-gate patient, he will take all the credit and he won't give any credit to the anesthetist, but blame anesthetist for any untoward problems encountered. But if something goes wrong, it is anesthesia related complication. This was happening more a few years back, like 25, 30 years back, that any complication, intraoperative complication is anesthesia complication. And patients were also accepting at that time, but things are changing. And the last is ugly surgeon. This type of surgeons, I had those type of surgeon, and I will say don't go to the surgeons, leave them alone. They treat anesthetists as technical cadre, show no respect. They are very demanding and imposing. They want everything to be done by anesthetists. They don't keep even adequate staff. Use abusive language. Do not realize one bit about the capabilities of their anesthetists. They are arrogant, self-centered, and so on. However, many of these guys with these attributes are the favorites of hospital admins, as they bring patient by any means possible and generate more income. But luckily, I see nowadays that this type of ugly surgeons population is going down and down. I will say only 5 to 10% of the surgeons are like this, and things are changing luckily. So, whom to select? This is very important. Obviously, you select a good surgeon and avoid bad and ugly surgeons. But as a beginner, sometimes you start going at the bad surgeons because no one is going to that particular person. No senior anesthetist want to work with them, so you get priority there. So sometimes you start working with them, but with time you realize who is good surgeon and bad surgeon and ugly surgeon. All are not lucky enough to get good surgeon. All anesthetists don't get lucky good surgeon. Some get good bad surgeon, and some even ugly surgeon. You 8 to 10 working hours in a day. Usually we have 8 to 10 working hours in a day, and we have to select from surgeons from these 8 to 10 working hours. So thing is, if you get stuck to ugly surgeon, if you start working with ugly surgeon, and if you get stuck there, you won't get time for good surgeons. So if you leave them, take a brave decision, leave those ugly surgeons, and you will start getting good surgeon. If you are doing good work, if you are doing safe anesthesia practice, definitely it is 100% that you will get good surgeons with time. But you need some patience. Sometimes there is a waiting period, especially in big cities. But in this waiting period, be patient. Don't do in hast. Don't start doing unsafe anesthesia practice. Don't select ugly surgeon. Avoid them. And with time, with your good practice, you are going to get good surgeons always. Most important thing, learn to say no. Uh, sorry, learn to say no to ugly surgeons. This is very important, sir, aspect of the freelance practice. You should learn how whom to say no and how to say no. Such always avoid such surgeons. You will be in peace. You are going to get good surgeons in future. So start telling no to this surgeon. Time management. This is very important aspect of freelance practice. Sometimes you are getting number of calls in a day. Suppose you have a surgery from 7 to 10 a.m. in the morning, and you get another call from another surgeon at from 10 to 12 or 9:30 to 12. And if you say yes to that surgeon, you have to rush there. You have to compromise during first surgery, which is posted for from 7 to 10 a.m. and you have another call at 10, so you require some transportation time. Sometimes surgery get prolonged, sometimes you require a monitoring in the postoperative period. Always keep half an hour between two OTs. This is very important. If you are supposed to complete the case at 10 a.m., take next call at 10:30. Don't rush to the next call. It will harm you, your practice. It can harm your patient. It will spoil your peace of mind, and with time you will be in trouble, and you will lose the reputation of a good anesthetist. Never take overlapping calls. Keep some time between two OTs, as I said. Always keep half an hour between two operation theater schedules. Don't let your surgeon wait for you unnecessarily. Sometimes it happens and everybody understands. Surgical colleagues also understand. But if you start doing it regularly, obviously you will get replaced by another anesthetist who is punctually time. So unnecessary, when you know that your OT is going to finish at certain time like 10 a.m. Don't take another call at 10 a.m. Always tell the surgeon politely that I will finish my work by 10:30 and I can come to your hospital at 10:30 only. If he is comfortable with it, go for it. Otherwise, say no to him. So the time management is very important in freelance practice. If you don't follow it slowly and steadily, you will lose your practice. You are the boss of OT. When your surgeon is operating, you are the boss of OT. You have to take many tasks during OT, especially as a freelancer. You have to support the staffs when he is in problem. You have to manage certain things like make sure that you have adequate instrument, drugs to provide safe anesthesia. You have to make sure this thing that OT is good enough for providing safe anesthesia. It is less, if something is lacking, discuss with the surgeon and ask him to purchase those things to provide safe anesthesia. Invest in monitor. Suppose you are working in a small nursing home, he or she must be having a multiple monitor with ECG, pulse ox and NIBP. That is fine, but he has not invested in ETCO2 monitor, and we believe that ETCO2 monitor is must to provide a safe anesthesia. Then you must invest in ETCO2 monitor. There is no harm in it, because you are going at 5 places where there is no ETCO2 monitor. You can purchase it and you can use it all 5 places to provide safe anesthesia. It will give an impression that you are following standards of safe anesthesia, and it will ultimately help you. Always keep an emergency kit with you. Sometimes in a particular nursing unit, they have one laryngoscope, one set of ET tubes, and emergency drugs. And in emergency, you will find that either your laryngoscope is not working, or some emergency drug is with expiry. Then you will be in trouble. That's why always keep an emergency kit with you, which has things like laryngoscope, bougies, tubes, LMS, and some important emergency drugs. So this is very important. Always keep it with you in your car. So whenever you require it, you will get it. And if you are going some nursing regularly to some nursing home, always keep a habit of checking the things repeatedly. Keep 2 laryngoscopes. If surgeon has kept 1 laryngoscope, ask him to purchase second, or else you can purchase second laryngoscope and keep it there. Or always keep a register of emergency drug, which you should check periodically that drugs are not getting expired or it is used and not replaced. So always keep this habit. Give some time to that operation theater, because you are the boss of the OT. Check whether there is adequate drug supply or adequate monitor or instrument are there or not. So always prepare a checklist which you can check every monthly for safe anesthesia practices. Training of staff, this will help you in emergency condition. Train them to help you at the time of induction and extubation. If you train them, they will definitely help you. In small nursing home, you don't have separate staff of anesthesia for anesthesia, so same staff will get scrubbed after you complete the induction, and they will again help you at the time of extubation. And if you have good practice, you can keep an assistant with you, which he will help you during inside OT, as well as sometimes he can help you for driving also, because you are running from one nursing home to a second nursing home. If your driver comes staff, he will be very helpful. Train them for CPR. This is very important. If you periodically train them, they are accustomed to do it when there is emergency. So always keep training them for CPR. Train them for emergency airway. uh, ask them to insert LMA under your guidance. When you are inducing the patient, keep them with you. You can teach them how to insert the LMA, iGel or endotracheal tube, which will help you when you are not available in hospital premises. Sometimes you have shifted the patient to the post-operative ward or in the room, and you left the hospital. And if some emergency happens, he or she should be trained enough to handle the emergency airway. So staff training is very important the aspect of the freelance practice. Post-operative care, this is very much lacking in the freelancing practice. We don't see the patient in the post-operative period. Never leave hospital before shifting the patient. I've seen the anesthetists who leave the hospital at the time of closure, especially when surgery is going under regional anesthesia. It is a very unsafe practice. Sometimes patient will collapse while shifting. So always shift the patient to the ward or room, take vitals, give necessary instruction, then only leave the hospital. Post-operative monitoring is must. Always keep a monitor like pulse ox, NIBP, ECG in the post-operative ward. Post-operative visit if required. If patient is high risk, always go for a post-operative visit after 4 to 6 hours of surgery. Sometimes you can save the patient by this single visit. And obviously, if surgeon is good, he will pay for this post-operative visit also. Patient management. This is second most important part. PAC, preoperative assessment, is not always possible for a freelancer because you get a call, you go there, you don't have a time to preoperatively assess the but we can establish a PAC clinic if we start doing it in a group. Suppose if you find anesthesia colleague who are your friends, so you can start a PSC clinic. You can stay there from a specific period like evening 5 to 7 p.m. And some of you will stay there and assess all the patient in the evening who are going supposed to be operated next day morning. So that can be done. It looks bit difficult, but it can be done. If you cannot do PSC, immediate perioperative assessment is important. Sometimes we miss this also in the freelance practice. Patient is on table, ready for spinal. Staff has painted and draped, and we miss the preoperative assessment. So always do immediate preoperative assessment. Check the investigation. Check the ECGs or echoes if it is done, and then only go for the surgery. Informed consent and counseling of the patients and relative is very important in the era of medical legal cases. There are lots of a number of medical legal cases are increasing, and that's why you have to always go for informed consent and counsel the patient and relative in the preoperative period. Always explain about risk involved in the surgery, type of anesthesia, and if required, change in the plan of anesthesia. So this is very important. Intraoperative management, make the patient comfortable, respond to patient's smallest complaint courteously. Sometimes we are in hurry and we don't give answer properly. Never ignore complaint of the patient. Even smallest complaint, sometimes it will give some clue and you can save the patient. Be careful about conversation inside OT when it is under regional. Sometimes surgeries undergoing under spinal anesthesia or block, and conversation amongst us is heard by patient, and sometimes it can cause some legal problems. So be careful about it. Don't use social media inside OT when some surgery is going on. Avoid using social media. Social media is a boon as well as sometimes it can cause serious problems. So you can learn certain things like anesthesia on group like the anesthetist, but it can become sometimes disastrous also. Post-op management, take care of post-operative pain, give regional anesthesia, give adequate drugs to take care of postoperative pain, so that patient become comfortable in the postoperative area after coming out of anesthesia. Give necessary instruction after shifting to ward. Monitoring instructions should be given to the staff, and they should be trained to record vitals every half an hour or 15 minutes, whatever required. So post-operative pain management and monitoring is very important for the patient aspect. So it is important to become a perioperative physician from an anesthetist. So we usually take care of intraoperative care only as a freelancer, but start taking care of preoperative part, intraoperative part, and postoperative part. That will make you a perioperative physician from anesthetist, and that will increase and improve your practice as a freelancer. You will get good calls, you will start working with good surgeons. They will realize that you are a good anesthetist. They will pay you for your good practice, and they will wait for you even if you are not free. So to become a successful freelancer, it is important to become a perioperative physician rather than being only an anesthetist. Financial management, this is very important. Everybody needs money. We are working for money, but there should be some limit also. We have to follow RVG system. Indian Society of Anesthetists, especially Private Practitioner Forum, has established a system which can guide you to take charges according to your city. But for implementing it, unity is must. Everybody must follow it. You should have a good association and good unity. We have to be flexible, but we should never bend against surgeons. When it is about charges, sometimes there is a poor patient. In those cases, we have to become little flexible. But in every patient, if you start bending, then they are going to exploit you. Don't compromise just to get entry at new place. This is happening commonly. As a freelancer, you want to get entry at certain hospital, and you will tell the surgeon that I will do the same surgery in less charges. This should not be done. There should be unity amongst our colleagues, and it will help you in future when you become senior. If you are united, and if you establish a system, when you someone new, when you become senior and some junior comes in practice, help them to get established. Otherwise they will spoil your practice by taking less charges. So what is RVG system? This is in Rajkot we have started this. There are three types of unit: base unit, modifying unit, and time units. So base unit are according to the type of surgery. Suppose for minor surgery there are 4 units, for major surgery 10 to 15 units. Time units, it is every 15 minutes you get 1 unit. And modifying units, like according to the age, as a type, and other morbidities, you can modify, you can increase the points, and you have to calculate those units and charge accordingly. You can charge for a unit from 200 to 1000 rupees according to the type of city. You can decide it, and you can charges according. So there should be some uniformity. Like here we have formed certain surgery like general surgery, breast surgery, lump excision 4 unit, or major surgery like intestinal resection 10 units. So according to that you can charge, and you can create a uniformity amongst anesthetists for charging the anesthesia charges. Practice enhancement and development. This is commonly neglected, especially in freelance practice. We are busy in earning money, we are running from here and there, and we forget to improve our knowledge, we forget to enhance our practice, we forget to read anything new. We are doing it monotonously, like we are giving spinals and general anesthesia. We forget to read. So reading is very important. Learning new things and implementing in practice is very important to become a successful anesthetist. If you don't do it, slowly your practice will go down and you will not enjoy your practice. Most importantly, attending conferences is very important. Online learning and teaching is very much available in various anesthesia group on Facebook as well as on WhatsApp. You can learn there. Even on Google you can find any material. Teach others also. This is very important. If you know something good, teach others. When you teach someone, you will learn more. For teaching someone, you need to read more and more, and you will learn more things. So sharing the knowledge is very important also. Documentation and data collection is neglected many times, but nowadays Private Practitioner Forum of India has prepared a preoperative assessment, anesthesia note, and consent guideline also, and you can print it and use it. Data collection, it is not usually done, but you can collect your data and publish it. There are apps like R&D app or apps where you can enter your data and get the result. Keep a budget for conferences and books. Always keep some budget for conferences and book. It is your investment which will give you returns on long term. Initially you think that I have lost x amount of money by attending this conference, but you have learned a thing, you have gained a knowledge, and which will improve your practice. Give time for family and personal hobbies also. Sometimes we forget family and personal hobbies, earning monies. So always give time for your health. Give some time for your health also. It is not always money. Give some time for poor patients also. Sometimes you are called for some camp, go there. It will give you satisfaction. Never forget, this is last and very important, never forget about safe anesthesia practice. It is very important. Don't compromise on safety of the patient or safety of the anesthesia. Sometimes you will be in trouble if you compromise on it. So I wish you a happy and safe freelance practice, especially with who are newcomers in the branch of anesthesia. Uh, Keep learning, keep teaching, always do safe practice, and never compromise on safe practices. Thank you very much. Hope this presentation will help you to start a good freelance practice. Thank you very much.